Well, for the patient, the incisions and the surgery seems very similar, but her doctor has more accessibility to her tissue and can be more accurate. That generally means that the camera to put inside the patient's body is a 3D camera. So that goes through the navel, and then the devices that go through the small tubes on either side have, think of it as tiny little hands, where the little device has 2 wrists, so the surgeon can be much more dainty and careful with the tissue, and the 3D camera opens up a vista of anatomy, very much like ordinary open surgery used to be, but much less invasive to the patient. So it gives the surgeon back her hands, and we can be much more meticulous with our surgical technique again. That's what makes me excited about the Da Vinci robot, because when I was doing surgery with simple laparoscopy, I felt like I had one hand tied behind my back and perhaps one eye closed. But with the Da Vinci robot, because of the 3D vision, and plus we can magnify the field of vision by about a factor of 10, the blood loss is much less, the time under anesthesia is much less, and hence to the patient, her complication rate in many ways is less. So there's less pain in recovery, and if you have less blood loss and less pain, you're on your feet faster, you get back to work faster. Most of my patients can drive in a week and go back to work in 2 or 3 weeks, depending on what type of work they do.